Taoist Zangfu acupressure, which we used to call pressing point massage for a time in English when we were teaching it in the 90s, was the first physical treatment skills I was taught. If we couldn't find, feel, and manipulate the flow of qi with my fingers, if I couldn't find them on the body cavity, then how could I have been expected to find qi with a needle further separating me from my patient's body? Now, they certainly believed I'd be able to recognize the qi. Oh, it's achy. Oh, it's full. Oh, it's throbby. Oh, there's electricity moving down. But for me to recognize it in the needle as opposed to hearing it in the patient, to recognize what has to be shifted to touch and interact with qi through a needle without already having bodywork skill, it didn't even occur to Professor Wong when I began my training with him. To him, you start with bodywork, then you integrate herbs, and then acupuncture is an extension of your hand into the body. And that was the learning progression he comprehended, and therefore that's how he taught. Now, Dr. Xie, when I met him, was no different, except for him, he believed one had to begin with Dao Yin, internal cultivation practices that are quite physical, not just meditation, sitting meditation, to recognize my own qi and to be able to affect it. So for him, instead of wanting to learn body work so I could palpably feel what qi was, he wanted me to be able to feel qi in my own body through Dao Yin or practice so that I would recognize it and be able to work with it in others. And when we first met, all of his patients got qi work via body work as the primary treatment method. His belief in the martial arts side of the system was that if you have good hand fighting skill, you can pick up anything and adapt it as a weapon. And if you have a good hand healing skill, you can pick up any tool and adapt it for medicine. The medicine, the needle, everything was always stressed as simply an extension of the self. And in terms of the needle, it was the concentration into literally a fine point that can be inserted into a patient of my hand or of my qi. Now, for Dr. Li, the third of the great teachers I had, the very idea of acupuncture without manipulating qi as its basis was so offensive to him that he stopped letting younger doctors with no cultivation practices watch him needle at all. They were sent out of the room, no questions asked. This was his protest to the change in Chinese medicine and his constant anger on this topic. If he looks a little tired, he's 92 now. And so when I'm in Beijing with him and he's looking a little tired or I'm a little worried, all I have to do is reintroduce this topic a little bit. And then he's fully present for the rest of our 2 hours, 3 hours together. It's amazing how that will just go. Right? Unfortunately, if I arrive and he's already ticked off because of patients he's seen, I've got 2-3 hours of ranting as our footage. So, his constant anger on the topic reminds me of something Dr. Xie used to say about why he ignored most of the students who came to his door to study. And he would say, 心不明，何必颠倒? If the heart is not clear, why bother turning on the lights?